Again, with a developing story tonight, a man in St. Louis has become the first in our state to die from vaping.
This marks the 8th death in the country. Our Jenna Barnes spoke to the ICU doctor who treated the man. She's live at Mercy Hospital in St. Louis. Jenna.
Mike, this doctor told me the man started vaping just a few months ago. Then he became critically ill and he died yesterday.
His lungs were so sick.
Dr. Michael Plisco says his patient, a man in his mid-40s, started vaping just this past May to treat his chronic pain.
He found that vaping was helping that, and because this was at a time where we really weren't making a big deal about lung injury cases, then we don't know what we don't know, so it seemed like something that was reasonable.
Before he began vaping, his lungs were healthy, but within weeks he started feeling shortness of breath. By late August, he was hospitalized in southern Missouri.
The patient was put on the life support machine prior to coming up to Mercy.
Dr. Plisco's ICU team treated him for less than 2 weeks. He says the man's lungs were in such bad shape, it caused heart failure. He died Wednesday morning.
His body just didn't recover.
The Missouri Department of Health and Senior Services has received 22 reports of vaping-related illness statewide. They've confirmed 7 of those cases, including this death at Mercy.
Your lungs were not meant to put toxins in them, so don't put any toxins in them.
It's easy advice to give, but even Dr. Plisco admits we need more research.
If you were going to try to explain this to your high school kid and say, hey, listen, here's the dangers of vaping. And if they say, where? I don't see any data. That's probably the worst part, is I don't see any data because there is none. We don't know.
Doctors also don't know what product this patient was using, but the CDC says most people who report vaping-related illnesses are using products that contain THC. Doctors say if you do vape, don't buy any products off of the street. Live at Mercy Hospital, Jenna Barnes, 5 on your side.
The number of vaping-related illness cases nationwide has now surpassed 500. They're being reported in at least 38 states, and more than half of the patients are under the age of 25. 3/4 of the cases are men. Experts say there's a reason it's taking the CDC so long to figure out what's causing the problem.
Patients may not even know what's in the products that they've been using. Patients may have been using a number of products, and they may not know which is the one or more that led to the injury they're experiencing.
The FDA has launched a criminal investigation into the supply chain and is now analyzing more than 150 samples. A new report says vaping more than doubled in the last 2 years among 8th, 10th, and 12th graders.